So the Simulation Center is a part of the School of Nursing building here. It was started to be used with nursing students, but now it's used across a variety of programs. So it's a safe environment for students to practice a variety of skills. It's a safe space for students to make mistakes. It's better to make mistakes in simulation than out in real-world practice. It's a way that they can get the pre-brief, the debrief, they can practice these skills, they can learn from their fellow students and their instructors. It's also a way for them to practice things that they might not see in real life environments all of the time, depending on where they work. But they can still get high fidelity practice of things like a code scenario or critical situations or populations they might not work with often. We also use our international students as interpreters. We get our theater arts students involved. So we have a variety of involvement here to create the most authentic situation possible for our students. For speech therapy students, once we have our graduate students here, we, specific to our program, we have a 27-week-old premature infant named baby Paul, and he's a high fidelity mannequin. He's one of the most high fidelity mannequins that we have, so we're very thankful to have him. And we will be using him for a variety of things, primarily the infant feeding and swallowing for that population. NICU units are required to have a speech therapist on staff, so it's important for students to have some skills with that. So again, the fidelity of wanting them to have the most highly realistic experience, all the way from, again, a code scenario, which is a very high intensity scenario, but it also is about how we communicate, how we give the SBAR report, right? How we're talking to other professionals, how we talk to our instructors, how we talk to its students. So it's a really holistic experience. It's not just about hammering the skill, it's really about these other skills that surround the scenario that we're doing. And we really see students go from nervous to really taking charge that I am a nurse, I am the dietitian, I am the speech therapist. They start to really own their role, and I think as a student that's an important part of the education experience. And those are just a few of the reasons that the Simulation Center at Viterbo University is just integral to the education of our future speech therapy students.